Hi, it's Dr. Sean Carlson here from Simple Orthodontics in Larkspur, California, here to answer the most common orthodontic questions that parents have. What is the difference between pediatric orthodontics and regular orthodontics? If you're like me and you grew up when orthodontics were a teenage thing, you're probably surprised why so many kids are getting braces. And the difference between pediatric orthodontics and regular orthodontics is simply the time of intervention. Now, the reason kids are getting treated at a young age is we've discovered as a profession how important early intervention is to the long-term stability of the smile and bite. And so this is one of those things that when we're treating children younger, it simply means that the orthodontist that is doing pediatric orthodontics needs to have an understanding of what that means. It's not just straightening adult teeth, it's dealing with the foundations of the jaw bones. And that's a real important distinction, and you need to make sure you find an orthodontist that understands what pediatric orthodontics is about. Now, there's a couple things that are important to look for when you're looking for an orthodontist that can handle a younger child. And the number one thing you want to look for is you want to find an orthodontist that your child can establish trust with. And our experience is trust is usually established when your child can have a relationship with the treating doctor. This isn't about you and the doctor, it's about your child and the doctor. And a lot of that comes from the doctor you're seeing talking to your child directly. Now, most of the time when we're doing pediatric orthodontic care, we're talking about second, third, fourth grade. So usually your child has had plenty of interactions with adults, whether it's through their teachers in school or their sports coaches. So talking to the doctor is something that they're ready for. And your doctor needs to make sure that they can talk to the children in a language that establishes trust. And that means listening, that means eye contact, that means careful attention to the child's needs. Now, when we're doing pediatric orthodontics, it is different than teenage orthodontics in that the types of movements that we're doing are specialized to that age group. So it's not just simply straightening the teeth. You have to understand how jaws grow and how adult teeth erupt. And this is something that's really changed in the last decade in orthodontics. Three-dimensional imaging, high-tech surface scanning of teeth is something that has eliminated so many questions and so much confusion for doctors who are treating younger children. If you're looking for a pediatric orthodontist, make sure that they're using three-dimensional imaging with the x-rays. Also make sure that they're using high-tech intraoral scanners. Impressions are over. There's no need for squishy alginate impressions that fill your child's mouth with a bunch of goop that is difficult to handle and is totally unnecessary in the modern world. High-definition surface scanners of the teeth eliminate all of that craziness. But as I mentioned, make sure that the orthodontist you're seeing has experience with young children, because it is important that your child has the most efficient path from the beginning of treatment to the end of treatment. So it's our opinion here at Simple Orthodontics that every child sees a pediatric orthodontist, and it's the same recommendation that the American Association of Orthodontists has, which is get your child screened by age 7, usually that's second or third grade, and get them screened by an orthodontist that is very well versed in pediatric orthodontics and early intervention. Because your pediatric orthodontist may discover things that your pediatric dentist wasn't able to see. And this is why it requires a very special professional to evaluate your child's dental eruption and orthodontic needs at a young age. Now, it's important to remember that not every child needs early intervention or pediatric orthodontic care. Sometimes waiting for all of the adult teeth to erupt is the best solution, and your pediatric orthodontist who is experienced in this will be able to give you that answer very quickly. If there's a problem that needs to be solved, they'll be able to solve it quickly as well. So early intervention, pediatric orthodontics is something that typically doesn't take very long, but it needs to be done by a special professional who understands that arena. So get your child in to be screened early. Make sure you see an orthodontist that is experienced in pediatric orthodontics or early intervention, and your child's smile journey will be easy. Now, we're always available to answer questions here at Simple Orthodontics. Be sure to follow us on Facebook, Instagram, and YouTube for lots more videos like these. Until next time, be well and smile more.